your child complaining of low back pain because they're toe walking on one foot or both feet? Is your therapist treating your child for their low back pain, but not actually addressing the toe walking on one leg or both feet? Hi there, it's Neesha from My Favorite Physio. In today's video, I'm jumping in to share with you a case study of a young boy who we met recently in our clinic. This young boy is 10 years old, and his parents report that he has been walking on one leg on his toes ever since he started walking. He's now 10 years old, and that toe walking is particularly bad on one leg, which is resulting in low back pain. For the last 2 years, he has been attending a physiotherapist to treat his low back pain. However, there is no mention or treatment to look at why he is toe walking on one leg. Eventually, he has been referred to us by his pediatrician, and we did a full assessment for this boy. From our assessment, we actually determined that this boy has mild cerebral palsy, which is causing that increased muscle tone on one leg for him to go up onto his toes. So the toe walking is actually putting him a little bit off balance because one foot's gone right onto his toe and the other leg is trying hard to stay balanced. As a result, his hips and pelvis are out of balance and he's getting low back pain. By treating the muscle tightness or pain in his low back without actually correcting the cause of it, which is the toe walking, the child is not actually getting the right treatment. So the correct treatment for this boy is actually addressing the toe walking, addressing the increased muscle tone in that leg, which is causing his foot to go onto his toes. And literally by now, his foot bones are all quite turned and deformed. So the correct treatment for a child like him is really serial casting to correct the foot posture, get the calf muscles down, radio shockwave therapy to release and reduce the spasticity in that leg muscle, and gait retraining to help him learn to walk properly, both with his feet down flat, heel strike, foot flat, push off. It is going to be a lifelong condition that we need to treat and manage. He has mild cerebral palsy. It has affected his ability to walk, run, hop, skip, jump. So really, it is a specialized area of pediatric physiotherapy that this child needs, not just musculoskeletal physiotherapy to treat back pain. So for him, we're now on top of it, but I wanted to share the story because I think there are actually probably more kids out there with mild cerebral palsy where one foot or both feet are on their toes, causing low back pain, but not correctly diagnosed and being treated by therapists who are not actually fully aware of the big picture for a child like this. So if you're out there, the take-home message is this. If your child's on their toe walking on one leg or 2 feet, it is important to actually understand the cause for toe walking. The best person to go to is your pediatric physiotherapist or your pediatrician. If your child is complaining of low back pain, it is important to actually make sure that they are assessed fully, not just in their lower back, but to look at the way they're standing, the way they're walking, the way their back is, aligned or not, because sometimes children have scoliosis, maybe throwing them off, and their spine is twisted that causes their low back pain. Trying to release muscles alone isn't the correct treatment for children like that either. So if you have a child who is under 18 and having any difficulties with their gross motor skills, the best person to speak to is a pediatric physiotherapist, not just any therapist that you find around the corner from your home. Now, if you're concerned about your little one, please ring us here at My Favorite Physio. The number to ring is 02-9790-4233. And if you know somebody out there who's got a child who seems to be walking on one foot on their toes or both feet on their toes and complaining of back pain, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.